Hello, everybody. Today in our morning meeting, we're going to talk about allergens and how important it is for us to make sure that we're not feeding our patients allergens if they do have a food allergy and why. So first, we're going to start off, what is a food allergen? A food allergen is a protein that's in a food that some people are allergic to. Food allergies can be mild or they could be severe, and it can make our patients sick. And we do not want our patients to be sick. They're already here in the hospital, already not feeling well, and we don't want them to start feeling worse than what they already do or to get sicker. So when somebody ingests a food that they're allergic to, they could have certain symptoms of nausea, vomiting. They could have, vomiting, diarrhea. They could get a rash on their skin. They could get hives. They can be itchy. They can, start getting shortness of breath where they can't breathe. Their throat can start closing up. Their throat could be sore or itchy. Those are, the most common symptoms of, if you have a food allergy, those are the most common symptoms. I have a little godchild and he is allergic to a lot of things. He's allergic to bananas. He's allergic to all the outside pollens, especially the outside pollens like the grass and stuff like that. His eyes will swell up. He'll get, he has really bad eczema, but he'll start breaking out. He's highly allergic to eggs, where if he does ingest even a little bit of eggs, he'll start vomiting and having a diarrhea. And he even has an EpiPen. So, it just goes to show you that a variety of foods can cause allergies and, causing you to have all these symptoms. And we need to make sure that we're being careful when we're providing patients with food, that we don't give them a food that has a food allergy to make them sick. So, like we had talked about, when somebody ingests a food that has a food allergy in it that their body cannot tolerate, it could be mild. They could have a couple of hives. They could have nausea, vomiting. But if they have a severe allergic reaction, it could be life-threatening. That's called anaphylaxis shock. This is considered a severe food allergy that causes them a severe reaction, and if not treated quickly, can cause death. So if anyone would go into anaphylaxis shock, if you're not at work, you need to call 911. If you're at work, then you need to call a code blue. They need to get medical help right away. So the big 8 food allergens are going to be milk, soy, eggs, peanuts, tree nuts, wheat, fish, and crustaceans, which could be crabs, crawfish, all the things that we like here in South Louisiana. So we just need to watch out for that, okay? When we're talking about food allergies, we need to go and read the food labels. Every food that we have in the facility has a food label. They have the nutrition facts. That's where we're going to find out if that food has that allergen in it. So food allergens have to be listed on the food label to let people know if that food item contains that food allergen. At the bottom of the food label, they're gonna have a word. It's called contains. It's gonna say contains, and it might be milk, soy, wheat. Those are the major allergens, and they put that at the bottom in bold so that way you can see that this particular food item may contain milk. So if it contains milk and you're allergic to milk, then that means you should not eat that food. So whenever there's a food allergen that we might not know offhand, and, we're preparing a prepackaged meal, or, let's say we're using some kind of base like a chicken or a vegetable beef base, and the patient might be allergic to something that's in that base, we need to go in the storage. We need to go grab the base, and we need to look on the back of the food label and see, does it contain that item? No matter what, when a patient has a food allergen, you need to come get the registered dietitian to look and check to make sure if that item has a food allergen, because a lot of the ingredients could contain a food allergen, and it might not just come out and say milk, it might say something else. So you need to check, and always go check with your registered dietitian to make sure that that food item does not have that allergen in it. So when we're serving food to patients, when we're going to take their menus, we need to ask them, hey, Mr. Bob, do you have any food allergens that we need to know about? If Mr. Bob says no, then we can continue on and say, okay, these are our options for today. Would you like this, that, or the other? We get their food items. We make their tray. We go bring it up to them. We're good. Whenever we go bring up their trays, we need to ask for 2 patient identifiers, which would be their name and their date of birth. We need to explain to them what the food is on the tray. And we can ask again, hey, Mr. Bob, this is what you got. Are you allergic to any of these foods? And Mr. Bob says no, then perfect. Now, if we have somebody that is allergic to milk, and once we make that tray, we need to make sure that we are not putting milk on the tray. So the dietitian needs to check off that tray. The supervisor needs to check off that tray to make sure that there's no milk on that tray before we bring the tray up. And then even again, you can ask for 2 patient identifiers, and then you're going to say, Mr. Bob, I see that you have an allergy to milk. This is all the foods that you have. You don't have any milk on your tray, and you should be good, okay? We just need to make sure that they do not have that allergen on that tray. There's something called cross-contact. Cross-contact is when foods with an allergen, when those foods with an allergen are in contact with a food without the allergen. If they're in close contact, if you use the same knife, utensil, without cleaning or sanitizing it in between, then the food without the allergen is going to now contain that allergen, which that food now becomes unsafe. So we need to always remember to wash our hands. If we're messing with chicken and they got a patient that's allergic to chicken, we need to clean up behind ourselves very good with the chicken. We need to sanitize our utensils. Maybe we can prep their food item first before we start messing with the chicken. We need to make sure the condiments or anything that we're using does not contain any chicken in it. We need to make sure we're labeling good. Make sure that, we have a little allergy sticker to say, this food does not contain this, that, or the other. Make sure we know that this is for a specific person. And we need to make sure that when we are prepping, cooking, anything we're doing, it's separate. We're not cooking the chicken with something else that, doesn't need to have the chicken in it or for that patient. Okay. So we need to separate, label. We need to watch our condiments. We need to prep. We're going to prep first. We're going to clean, and we're always going to wash our hands and sanitize surfaces, utensils. Everything has to be separated. And I hope you enjoyed my video and my presentation. The end.